Hey, everybody. Thank you so much for joining the live stream. We are really excited to be talking to our partners up in Traverse City. We've got some of our colleagues from Mary Freebed at Munson Healthcare, and we're excited because they're continuing to expand their team of highly skilled physiatrists in the Traverse City area. And I've got two of the team here. It's just a pleasure to connect with them and to hear about the work that they're doing and how they're helping patients. So on the live stream, we've got Dr. Barent Bradt. He is one of the physiatrists up on the team. And we've got Dr. Kaitlyn Vanias, who they're both bringing just a wealth of experience to the region, providing this specialized care of rehabilitation to patients. So we're going to talk a little bit about their background and what they bring to patients and some of the different types of patients that they're working with. So in this conversation, I think you'll really learn a lot and see how they're helping patients across Northern Michigan. So Dr. Bradt, we're going to start with you. I want to just hear, in your perspective, for someone who's maybe never heard of physiatry, this physical medicine rehabilitation, how would you describe what a physiatrist is and how they work with patients?
Well, I think that probably the most important part of our job is trying to meet the patient where they're at in their injury, recovery, hospitalization. So we do a whole spectrum of care from our inpatient unit here at Munson, where we're dealing with patients that have, had strokes, have had long hospital stays, bad injuries. We're trying to help manage them medically and get them back to the point where they can go home and be in the community. And then, we follow those patients as they recover and continue with those therapies even after they're out of the hospital. And more on the outpatient side, we can be doing anything from treating chronic back pain and joint pain to treating spasticity as a result of some of those bad injuries. I sometimes joke we're the love child of an orthopedic surgeon, a neurologist, and a physical therapy. If you put all those together and mix it, we're somewhere in the middle.
That's a great analogy. I've not heard it said that way before, but that's perfect.
Yeah. We kind of dip our toes into a lot of different areas.
Mm-hmm.
But I think the most important thing is we kind of cover a lot.
Mm-hmm.
And so we're able to, think outside of the box and try to come to the best solution for the patients.
So Kaitlyn, in your perspective too, like how would you describe rehabilitation to maybe a new patient that you're working with and they've not thought of physical therapy or thought of rehabilitation and they've never heard of physiatry? How would you describe it?
Yeah, I actually have a similar line as Barent, that we're kind of a cross between non-operative orthopedic doctors and neurologists. So we're really musculoskeletal experts and try to see the big picture because we're not kind of targeted to one organ system.
Mm-hmm.
So we see people with big injuries like brain injuries, spinal cord injuries, amputees, as well as people with more run-of-the-mill musculoskeletal injuries, and try to get them back doing what they like to be able to do.
So Dr. Bradt, this is such a great conversation to get to know a little bit more about you guys and your work. So who are some of the most common patients or diagnoses that you're working with the most?
So I primarily see people on the outpatient side of things. I do a little bit of hospital coverage on the weekends, but otherwise I'm primarily over at the Foster Family Center. I do a lot of chronic back pain, acute and chronic back pain, really, and same with the joints, acute and chronic joint pain, nerve injuries, and so the whole spectrum. And oftentimes there's not just one problem going on for a lot of those patients. They may have a lower back or neck injury, and really, a shoulder or hip is contributing to it. So that's the mainstay of what I see. I do still see a few patients for spasticity management and amputee management, but the majority of what I'm doing is kind of the chronic joint and back pain.
Okay, what about you, Dr. Vanias? What are some of the main patients that you see in diagnoses in your work?
Yeah, so I work in a couple of different settings. I have a clinic. I work in the acute care side doing rehab consults, as well as a subacute setting doing rehab consults. So I see a variety of diagnoses, but a lot of people with neurologic conditions, a lot of strokes, brain injuries, and kind of follow them along the continuum of care from acute care to rehab and then as an outpatient.
Okay. And it's so interesting because it's just bringing you both here to this area to just talk about it and just help to reach more patients. Because, I've seen it's just sometimes people don't know they need rehab. So to help them, educate them and to know that that is an option for them and how, it's not just going home right away or, just kind of giving up and saying, okay, I'm going to just be kind of stuck in this place. There's so much opportunity for them to grow and to get back to a new normal for them. So, and it's so good to talk to learn more about like the background with you guys. So, Barrett, what drew you or brought you to rehab? What interests you, and how did you get into this field?
Well, I'm pretty talented at hurting myself. So I've been an athlete in variety of means throughout the years, and I've had a lot of injuries throughout the years. And so that actually drew me into my undergrad, which was in athletic training, and I worked with a couple of PM&R docs at Michigan State, and that kind of sparked my interest into going into PM&R. Um, but yeah, so it's really kind of a long history of my own personal injuries and saying, hey, I want to figure out my own body.
Yeah. And you probably have to help your patients figure out their bodies too. There's so much our bodies can do that we don't know. And so you're helping them to learn to listen to their body. So with your experience in athletic training, how has that like helped you as a clinician? How did you learn from that?
Oh, I mean, massively. I mean, I had the privilege of working not only with collegiate athletes, but also in an orthopedic surgery clinic, working with patients that have had polytraumas and hand injuries. So I had a couple of years of experience that really brings um, kind of I try to give patients an idea of what's wrong with them and the route that we're going to take to get them better. And the nice thing is I've had experience doing this with myself and other patients as an athletic trainer, trying to get them back to where they wanted to go. You have a chronic shoulder injury. We're trying to strengthen the muscles and manage your pain while we're trying to get you back into play. And that does a lot to, your average everyday, construction worker who's got to go back on a roof and finish a roofing job, and they have a bad shoulder. And it's different, but it's similar. They have to go back into some form of physical activity with pain, and we're trying to get that shoulder or that neck or that back stronger, more tolerable, with less symptoms, so they can do what they have to do.
And then how specifically, like this background in athletic training, how has that helped you become a better doctor? How has that helped you better work with your patients? And 'cause, I mean, it's probably just a unique perspective to bring in that this training, this athletic training, I'm going to bring to you, and you might not be an athlete, but you can benefit from this perspective and this plan.
Well, I mean, yeah, it is. I'm pretty good at unwinding kind of and finding root causes of
Mm,
things, and not just chalking it up to back pain or to
yeah.
hip pain or to shoulder pain, because I have experience trying to diagnose and treat patients in the athletic training world, where you're very limited as to what you can do, and it's only hands-on. So I pride myself in doing a really head-to-toe physical exam to try to find everything that's contributing to the current problem, and then
Hmm.
trying to find the root cause, and starting from there, start a rehabilitative plan based off of finding that kind of linchpin root diagnosis.
Hmm. That's great. That's great. So Kaitlyn, I want to hear about your background. What drew you to this field of, PM&R?
Yeah, I liked the breadth of human art and the overlap with neurology. I like that you can work in a lot of different settings like I do right now, whether that be inpatient rehab or clinic or doing procedures or diagnostic testing like EMGs.
Hmm.
Uh, and I like that we just don't have one like silo or organ system, although it does make our field hard to explain to people.
Yeah. Yeah. So, and you also have some athletic experience. You are a lifelong endurance athlete. Tell me a little bit of like what that is and what are some of the things you've done, and maybe how that has helped you in your work.
Yeah, I've done a lot of different sports. It depends on the season
Yeah.
and what I'm into at the time. I ran collegiately for University of Michigan. I've done a little bit of triathlon. I prefer cross country skiing and cycling right now. Um, so a lot of my patients with kind of athletic goals, it's really easy to uh, identify that with them and
Yeah.
find goals. But I think even if people aren't athletes, just the process rehab involves making goals and kind of
Mm.
optimizing the conditions to meet them.
Yeah.
And so no matter what you're recovering from, you kind of have to balance the recovery part and the training part and optimize all of the factors as much as you can.
Hmm. Have you had, moments where you could bring in an example from yourself to your patients? Like, how do you then bring this like training and, this passion to the patients that you're helping?
Well, I like to describe it to people like you're hiring a coach, or like seeing a rehab doctor or a rehab team is like hiring a coach, where they're trying to help you find your limitations, and the things to focus on, and just to kind of see the big picture and make sure that things are going the way that we expect or hope. And if they're not, and then try to figure out how to get things back on track.
That's great. And so the patients are why we come and we do this work. They're the ones that we're helping to get back to their favorite, passions that they had, or get them to a new normal. Barent, has there been any like recent success stories or things that you've been like, okay, this is the reason why I'm doing, and I've helped this patient reach their goal?
Oh, I mean, absolutely. I just saw a patient earlier today that was a fairly active individual for many years. Walking was her preferred choice of activity, and for the last 2 years, she hasn't been able to. And the first time I saw her, I did an exam, and I said, I really do think that you need some really good quality therapy directed at your back and core. And she'd already failed physical therapy, quote unquote.
Yeah.
And so I convinced her to go back in, and I followed up with her 8 weeks later, and she's like, oh my goodness, I walked for 30 minutes for the first time in 2 years. So she was just over the moon, cutting down on pain medications and walking further. And it was just with physical therapists. We have some amazing therapists that make our job very easy here.
Yeah. And I mean, we haven't talked about it, but I mean, you guys are part of like a multidisciplinary team, whether it's inpatient or outpatient. Like, can one of you just share what's it like working with the PTs and the OTs to kind of come together and treat the whole patient?
I think that's one of the things that makes PM&R unique, is that we're really used to working in teams, and we know that it's not as much of a doctor-centric relationship where we all kind of work together, have different strengths, and are trying to get people back to where they want to be. But yeah, I think that's one of the strengths, or the best things about rehab, is that we're just so used to working with other professionals and keeping the patient at the center of it.
Well, this has been such a great conversation. As we start to wrap up, can either of you share maybe what are some like common questions or like myths you hear from patients that they might have when they first start working with you guys?
Yeah, I'd love to talk a little bit about backs, because a lot of patients that go to physical therapy, they don't get better, and they think that they're just done, or they have a back injury, a disc injury, whatever it is, and they think that they have to be kind of a very sedentary, low level activity. And that's just not true. It may take time, but we can always find some kind of physical activity for somebody to do. And once we can find activity that they can tolerate, we can build, and we can build strength. It doesn't matter the age. It doesn't matter the activity. It doesn't matter the level of injury. We can always make progress. We just have to find that bottom line. So just because one session of physical therapy didn't do what we wanted it to, we may need to address it in a different way. We may need to clear some other problems that might be going on that contribute. But, you have the ability to be strong again, regardless of the injury.
That's great. So, Kaitlyn, if somebody wants to work with you guys, whether it's after an injury and illness and they're an inpatient, or maybe they're trying to see somebody like Dr. Bradt for outpatient, like what's the best way for them to kind of start that ball rolling to work with you guys in the team?
Yeah, good question. If they're in the hospital, the best thing is to kind of ask their physical therapist or their occupational therapist if it would be appropriate for them to see a rehab doctor while they're in the hospital. And we can often see them in the hospital and either try to get them to a rehab unit or recommend the best next steps after the hospital. If they're out in the community, then talking to their primary care doctor and getting a referral to the physiatry clinic in Traverse City to see either of us.
Yeah. Great. Well, thank you guys so much for taking time from your patients and clinic and work to come talk with us here. So I think it was a really great conversation. I hope the public that's watching this has really learned a lot. So once again, we're talking to some of our team up at Mary Free Bed at Munson Healthcare. They've been expanding their team, growing to just work with more patients in the Traverse City, Northern Michigan area. We've got Dr. Barent Bradt, who's a DO here at the hospital, and also Dr. Kaitlyn Vanias, an MD. And we're just so thankful for your guys' conversation and for just sharing some of your experience. So everybody, thank you so much for watching, and stay well.